Local vet Dr. Stephanie Wolf is back with us, and we're going to be talking about a Pet Talk segment about cancer.
Yeah, unfortunately, it is getting to be more of a common term that we discuss with our animals. It's obviously fairly common in people, and actually the rates of cancer in dogs and cats is about what it is in human beings.
Really?
A little bit less for cats, a little bit more for dogs, but it is a topic we do need to talk about for sure.
Well, if we have any good news, the good news is that, like people, when treated early, you've got some great treatments for it.
Yes, certainly we have broadened our horizons. There's radiation, chemotherapy, immunotherapy, and go on and on and on. And that doesn't include all the holistic and you know, alternative therapies that really are starting to make a real resurgence in the field and is becoming far more accepted than it used to be years ago. But the key is you got to get it early.
Okay.
And cancer, as we know, is obviously uncontrolled growth of cells. So the sooner you catch something, obviously, the better off you're going to be.
So this means you have to be a really vigilant owner because, as we have learned, dogs and cats don't present with pain easily. They try to hide that so they don't look like prey for something
Correct.
else.
But we do notice things such as maybe they're just not quite right. Maybe they've lost a little weight when typically they were putting on weight, and maybe now they're a pound or so down. You know, don't let stuff like that go without pursuing some true diagnostics before you get to a point where, you know, a tumor is so big or a condition is so advanced that you really can't, you know, go much further forward.
Now, when the first line of treatment, can you find out from just a blood test?
It depends. It depends on what you're dealing with. It depends on what organs you're dealing with. And really, I tend to shy away from telling people, well, do blood work, it'll give you the answer. Because it may not. It may eliminate a lot of other things, and it may direct you down the path of, look, in absence of anything else, we may need to go further. Ultrasounds, x-rays, MRIs, CT scans, they're now becoming really commonplace where we do have options to be able to pursue those sorts of things. But look on the skin, and that often, you know what, it's the largest organ of the body, and it's often overlooked. You know, sometimes things can start as simply as in the skin and spread elsewhere. Not in all cases, depending on what it is, but at about age 10 or so of your animal's life, it is fairly common that they will obtain some sort of malignancy down the road. Some of these malignant tumors are easily removed, no problem. Some of them aren't even malignant, they're benign, but they are a mass, they could change character. We have to really be vigilant to pay attention and not to let stuff go. Oh, well, it's been here for years. Well, what does that really mean?
Well, now in people, we talk about, is there like a genetic bloodline? If you know your animal's history, this would be something to check, too.
It certainly would be something to check, absolutely. If you know the breeding, the parents, other litter mates, et cetera, you might get clued in that, hey, we may have a tendency. Food is being used also as, you know, a dietary type of treatment, not exactly, again, without the other modalities, but there are now special reduced carbohydrate, and they up some other, you know, amino acids, stuff like that, antioxidants in there, that are specifically for patients that do have cancer. And they're living longer. They're living longer, you know, with their conditions, again, provided they're also caught early. But again, like I said, age 10 or so, you really need to start to pay attention. Not that you take the first 10 years and ignore them, because certainly cancer can present itself in very, very young animals as well, but tends to be more commonly after about age 10 or so. And then about half the deaths are cancer related.
But again, if you notice any changes, you should be making sure your animal is seeing the vet often. I mean, I can't tell you how many times I brought Bernie in just to say, I think, check this.
That's correct.
And there's nothing like hearing that it's nothing.
That's correct. And you know what? At age 10, really, you got to start bringing them in a couple of times a year. Twice at the absolute minimum, because they really do age quite a bit quicker. We're not really 100% sure why age seems to be related with cancers. Is it a weakened immune system? Is there something else going on? But really pay attention, because there could be something else that creeps up long before, say, a cancerous condition sets in.
Good advice. I want to thank Dr. Stephanie Wolf. She's the best. And you know what? We also want to thank the Niagara Veterinary Society for making sure that all our vets get here for this show. And we just thank you so much for coming in.
You're welcome.
Great information. All right, everybody, we're out of time, but at 3 o'clock, don't forget Pickler and Ben coming up right after General Hospital. A lot of great DIY stuff on their show. And you can actually forward Facebook and Twitter, and get in touch with these guys too. Hey, have a great day, everybody. Vote. We'll see you tomorrow.